Good morning, everybody, and welcome to the Weekend Wellness Workshop, heard on Saturdays and Sundays, 10 to noon, here on Pittsburgh Talk Radio 1320, WJAS. I'm Dr. Dennis Courtney with you today, as I'm with you each and every weekend, 10 to 12, here on 1320 Talk Radio WJAS. And we talk things health, we talk things alternative, new ways, new outlooks to optimize your health. And we bring you fascinating guests with very interesting topics to help you formulate a plan for how you're going to deal with your own issues. Now, there's no finer representative of how to put a plan like that together than our guest today. He is an accomplished board-certified cardiologist. He's also bar-certified attorney. What a combination. He gets to argue with himself. He's the author of 8 books to present date, and he has dealt with every medical controversy of noteworthiness that I've seen come down the pike in quite a while. His current book is really going to generate a lot of enthusiasm and interest. It's entitled The Toxic Tooth: How a Root Canal Could Be Making You Sick, is the way to take a look at how we're going to visit this issue today. And in collaboration with his partner on this book, Dr. Robert Kuloff, I also know very well. Also, let's say good morning and welcome Dr. Thomas Levy to our airways today. Good morning, Tom. Thanks for coming aboard today.
Good morning, Dennis. Always glad to be here. Thanks for having me.
Well, every so often, Dr. Levy, you get revved up and you come through town. And just about every time you pass through town, you cause a major controversy. And although I'm dying to get into the book that you've most recently written, I've already forewarned you, you cannot come on this show and not discuss, at least in some brief way, the last book that you wrote that you left people devastated with the consequences of what you wrote. And, of course, the title of the book says it all, because your last book was entitled Death by Calcium. Now, in the only way that I'm sure you can do it, could you give my listeners a good sampling of what that book was all about? Because I believe even to this very day, it raises quite an eyebrow when one hears the topic, let alone from a scientist who proves that you'll die if you take calcium. Could you do that for us?
Sure, I'd be happy to, Dennis. I would start by saying, a lot of times you try to come up with a title that's just going to catch attention, but might be an exaggeration. Well, the title of this book, Death by Calcium, is not an exaggeration. And the recent literature confirms what a lot of doctors, including my mentor, a dentist, Dr. Huggins, many years ago, was that although calcium is absolutely vital for your health, it's also vital for your death. I say that because there's a lot of things in the body that under one concentration have extreme benefits, and when you get beyond a certain concentration, they cause just as many problems. Calcium inside the cell should be at a very precise concentration, and when you exceed that concentration, you begin the process of increased oxidative stress inside the cells, and you promote all known chronic degenerative diseases, and it's precisely an important component of what causes carcinogenesis. For a cell to become cancerous is when the concentration of calcium gets too high inside the cell. All of this boils down to the point, and of course we're making a quick summarization of a fairly extensive topic.
Yeah, I know.
All this boils down to the point is that you should never supplement calcium. People with osteoporosis, yes, there's not enough calcium in their bones, but that's not why they have osteoporosis. And even though they don't have that much calcium in their bones, they have an excess of calcium throughout their body because the loss of calcium from their bones has been seeding their body for many years. And then you put on top of that calcium supplementation, you're just feeding the fire. So never, never, never supplement calcium. The book goes into what you should do to support good bones, including magnesium, vitamin C, vitamin K, and vitamin D. Each one of these supplements individually has been shown to decrease all-cause mortality, meaning to decrease your chances of death from everything. So that's because this calcium problem affects all the cells of your body.
Well, let's just say, as a little compendium of information, you blasted my listeners with the message I wanted them to hear. That and the poor ladies, and it's still to this very day, who have osteoporosis, and their doctors are insisting that they take calcium supplementation. I mean, you and I know this is the way it's dealt with by the conventional medical community, but to hear that that is quite leading to the opposite of what you're seeking is probably the message we can leave our listeners with for right now. Let's just say, ladies out there especially, and men, if you want to talk about this further and really develop a plan in coordination with the things that Dr. Levy's talked about, please come on in to see us. Give it a call at our office, and we'll be happy to pick that up. And thank you so much, Dr. Levy, for allowing me to just pry a bit back into your past. Now we're ready to move into your future. Are you ready to do it?
Let's do it.
You know, I look at your career, and here you are, a board-certified cardiologist, and I know that some things changed along the way early on in your career that moved you into the alternative realm. And the dental issues, and gentlemen in particular, and you mentioned them already, and I know we lost him last year, and I feel just terrible about it, but he was a great mentor to you. He certainly was a mentor to me. But this all started with dental issues. Isn't it odd that you're now coming back for a second look? Talk to us about the first look, the one that brought you to the conclusions of some of your earlier books, and then maybe that'll set the tone for this second look that we're going to have today.
Well, modern medicine just didn't explain, and it didn't allow for. I saw in his extensive clinic where he treated a large number of different things, treated by means of removing dental toxicity, and a wide number of chronic degenerative diseases, advanced neurologic disease, Alzheimer's, Lou Gehrig's, multiple sclerosis. These things got significantly better, and nothing in my traditional medical training told me that that was even possible. So, I mean, for me, I can't speak for other people, but a lot of bells and whistles started going off, and I like to say that with Dr. Huggins, who was a dentist, that my medical education began with a dentist.
Boy,
and,
so true. Mm-hmm.
And I can't give a more accurate description or a higher praise for Dr. Huggins than his life's work and what he led me to. He introduced me to a lot of other things, introduced me to the work of Dr. Weston Price, who did an enormous amount of work on root canal treated teeth and found that people that had advanced diseases of all variety, heart disease, kidney disease, you name it, that not only would these individuals get better significantly after the extraction of these teeth, he also took these teeth to his laboratory and he would surgically insert them subcutaneously under the skin and consistently showed, somewhat amazingly, quite amazingly, he would consistently show that the rabbits would typically get the same medical condition as the person from whom the root canal was extracted. And he would take one tooth from one rabbit, or one tooth from one person, and consecutively insert it under 20, 30, 40 rabbits, and that one tooth was able to induce that advanced disease in all of these rabbits. I mean, this is pretty horrible for the rabbits, so I'm not in favor of harming animals, but I'm just telling you what was demonstrated. And so, what we've lacked for a long period of time is the hardcore smoking gun evidence. We've known from the medical literature that periodontal disease, infected gums, for example, is strongly associated with heart attack and heart disease. We also now have, believe it or not, some studies that show if you have one or more root canal treated teeth in your mouth, you have statistically a greater chance of heart disease and heart attack. That's fairly new. But the thing that really got us going, Dr. Kulatz and I, was in 2013 in Finland. A group of investigators there collaborated with the cardiologists at their institution, and the cardiologists supplied these investigators with the aspirated or suctioned blood clots from patients that presented with acute myocardial infarctions or heart attacks. At angiography, they went in there, they sucked out all or part of the blood clot that was blocking off the blood vessel and gave it to these investigators. They found the typical pathogen DNA associated with root canals and associated with gum disease. Not only did they find that in these blood clots, they found it in nearly all of the blood clots, and they found it at an incredible concentration of 16-fold, 1,600% higher than the associated arterial blood. So forget link, forget association, forget correlation. This is cause and effect. There's no logical scientific mind that can look at this evidence and say that based on the finding of that higher concentration of pathogens in the acute blood clot that caused a heart attack, and it comes from the root canal and the infected gums, hey, ergo, root canals cause heart attacks, period.
There's the big statement. You always are known for these whammo statements. The calcium thing, now listen to this one, huh? You finally found cause and effect. The bullets are there to put in the gun so that nobody can avoid the conclusion that you've arrived at, and that's where this book really comes in, because it never was done before. You said you had inclinations of, you had strong convictions for, but you never had the ultimate evidence and proof, which apparently you have now, and which allows you and your collaborator, Dr. Kulatz, to write the book entitled The Toxic Tooth. And boy, this is big news. This is absolutely going to be changing the course of medicine, at least as I see it in my office, for sure.
Well, I want to rapidly add. Does this mean if you have a root canal, you're going to have a heart attack? No, of course not. Nothing is 100% in all people. But if you flip it in the other direction and you look at people that have had heart attacks, you're going to find this pathogen connection to the root canals and the gums present over 90% of the time. So of those people that get heart attacks, almost all of them have this type of toxicity. Now, obviously, there's a wide variety of immune system strengths. Different root canals will leak out different toxins at different rates. And there's a lot of cofactors, and also thyroid function, I'll get to that in a moment, cofactors that modulate how bad a root canal is going to be for you. But the bottom line is they're all bad. They're 100% infected. Hard to say that in biology, but if it's not 100%, it's over 5,000 consecutive extracted root canal teeth had high toxicity by the testing of Dr. Boyd Haley at the University of Kentucky.
All right, here's what I want to do. I want to stop and take a break. I can take a break for news. Then we're going to come back, and we're going to pick up where we left off. The people who are listening to you right now are now dumbfounded with the having to confront what's being done with their dentists is to help them may absolutely be ending up to hurt them. And so we'll come back in a minute and pick up where we left off. Okay, Doctor?
Sounds good.
There you have it, folks. We're taking a break for news. We'll be back in a moment and more about the toxic tooth from the guy who had to know, Dr. Tom Levy. Be right back in a moment. Good morning, ladies and gentlemen. Welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today on a Saturday morning and talking about things that, may seem foreign to you, but the messages that we'd like to bring to you are how to optimize your health. And certainly with the topic we have today, certainly how not to harm your health is maybe a better way to phrase how we've approached an absolutely important topic today through a gentleman just completing the writing of a book. The book is entitled The Toxic Tooth, How Root Canals May Be Affecting My Health, Making Me Sick, in collaboration with a dentist, Dr. Robert Kulatz. Our guest today is Dr. Tom Levy. Good morning, Tom. Thanks for sticking with us and welcoming you back. you were mentioning that the absolute proof is now present that I think the way you left us was as if you've had a heart attack, not if you have a root canal, but if you've had a heart attack, that heart attack, more than likely, and the highest percentage, way close to almost 100% of the time, was due to the fact that you had a root canal first. Did I hear that right?
A root canal or advanced gum disease, yes.
Or advanced gum disease. Now, let's just spend a little moment because these dentists are actually nice people, Tom. They really are. And they're out there trying to do their best to promote health. And they do three things. They fill teeth, they do root canals, and they do extractions. And we won't necessarily get into the amalgam issue today, but that all into itself is tragic enough on how detrimental it can be to your health. But these other two, root canal and cavitations, which are done, well, the cavitation isn't done on purpose, but extractions lead to cavitations. Could you spend a moment and just talk about the sheer logistics behind why these things were done? What happens during each of these processes that potentially leads to the tragic consequences that you're talking about today? How does it all begin?
Well, you mentioned the fillings, and of course, no big deal if you have a small filling and you get it taken out and you have it filled with a biocompatible substance, a composite, that's fine. But as fillings get bigger and bigger, you start to get closer and closer to the pulp of the tooth, and oftentimes it's either a very large cavity or infected gums that go down the side of the tooth and come back up the root of the tooth into the pulp. But either way, the pulp, the inside of the tooth, ends up getting chronically infected. And of course, the manifestation of that in most people is going to be pain to one degree or another. And so somebody comes to their dentist, they're complaining of a painful tooth. As often as not, the almost reflexive action is to do the root canal procedure. And doing the root canal procedure means they basically cut a hole in the top of the tooth, expose the pulp, the inside portion of the tooth, and they route it out. They scrape out and route out as much of the inside of that tooth as possible, and then what's called gutta percha or something similar to that. But that's not what is important. What's important is they took out that pulp, and as far as the patient and dentist goes, the patient is usually happy because the pain goes away.
Pain is gone.
And the pain is gone because they took out the nerves. They took out everything. But guess what happens when you take out the nerve, when you take out the blood supply, when you take out the connective tissue, the lymphatics, everything that's going on inside the tooth, you also take away the ability of the immune system to deal with any infection that's present. And after you've done all that inside the mouth, the most pathogen-laden part of the body, even if you didn't have infection at the start of the procedure, which virtually you always do anyway, you have infection at the end of the procedure, and even though you're not feeling pain, you're they can't get where they need to go. And because they can't get where they need to go, the tooth now becomes a chronic infected entity for as long as it stays in your mouth. And every time you chew, you actually squeeze the pathogens and toxins out of the middle of that tooth directly into the venous system, into the lymphatics of the body, just as reliably as if you took a syringe and injected it into the bloodstream.
Ooh, I can just feel the oozing of that mucky stuff moving out in the body with each chomp on that steak. Okay, with each chomp, you're squeezing more pathogens out. That tooth is infected, and by infected, there is bacterial invasion here. This word infection means it is under assault and literally under a putrefaction process because the tooth is dead now, right, Dr. Levy?
Well, you know, that's where we get into some little bit misnomers. I would submit to you that from the middle of the tooth up, it's dead. You've taken out the pulp. You still can have pain in that tooth because the tooth is still plugged into the jawbone, and the tips of the tooth are still connected to nerves, still connected to blood supply, still connected to lymphatics. So the part of the tooth that you see, yeah, you can pretty much say that's dead. But the rest of the tooth is not dead, and it can still cause you pain problems, and it's still sitting in a biologically perfectly situated circumstance to deliver the contents of the quote-unquote dead tooth into the living blood vessels and into the living lymphatics.
I want to ask a question because I haven't heard you mention it, and I'm a devotee of Dr. Huggins, and of course, it was Dr. Huggins himself who invented a word called cavitation, and he claimed that this could happen after any tooth extraction, and he compared it literally to what occurs in terms of pathogens and putrefaction and the like to a root canal. You haven't made that association. Is there a reason for that, or is it that you just didn't mention it?
No, the thing is that's perfectly right. What you just said about a cavitation is cavitation occurs at the site of an earlier extraction, either of a root canal or of an uninfected tooth, but they leave the periodontal ligament in, which happens almost all the time in today's dentistry. They don't do the additional procedure to take out the ligament. And when you don't take out the ligament, the bone that's adjacent to the ligament doesn't know that the tooth is gone on the other side of the ligament, so it doesn't heal into it. But at the top of the extraction site, it will heal over, and you'll get a little thin cap of bone inside, on top of a hole in the jawbone that is filled pathophysiologically with the same ingredients as you find in wet gangrene. So that's pretty toxic. However, for most people, the cavitation is not the toxic entity clinically that the root canal is, and this is because of the delivery system. If there's a small cavitation and it's sitting there in your jawbone, but it's not really near the nerve, it's not near any blood vessels, it's not near any lymphatics, and it's not directly connected to them, as would be the case with the root canal, and the tooth is still sitting there in place, and the roots of the tooth are still normally connected to the veins and to the lymphatics, it's not going to deliver those toxins as effectively as a root canal. Now, lots of people, especially when they get older, their bone quality decreases, and these cavitations start to get snake-like and grow on their way out into the bone, get down deep into the jawbone, get near the nerve, get into an area where you can start getting venous access. Then the cavitations can be just as toxic as the root canals. But for most people, especially younger individuals with basically healthy bone otherwise, the cavitations, although enormously toxic, tend to stay localized and tend to stay put.
And I guess maybe the final thing to say in terms of distinguishing the two is, with a root canal, the only resolution of that issue is the tooth must come out. And in the case of a cavitation, the tooth is already out, but the cavitation needs to be repaired. And it can be repaired, by the way, I should mention. But am I pretty much right when it comes to how you resolve these two? That's probably a tough call, because you go to the dentist and he doesn't know anything about this, or we can do a root canal and you beg him to have the root canal. Probably the wrong thing to have asked for, wouldn't you say, Dr. Levy?
Yeah, no doubt about it. And as far as dealing with a lot of dentists, and I don't want to come across as being anti-dentist. I'm just telling you I'm anti-root canal, and I'm not going to look at people's motivations or what they do or don't know. I'm just telling you that the medical and scientific evidence now nails down the toxicity of the root canal treated tooth. However, I don't know what they do believe, but they don't believe the root canal is bad. They don't believe it's toxic. And they're going to fight you tooth and nail. And if you're a submissive person, you're going to finally say, well, I don't want to fight with my dentist anymore. Do what you want to do. I hope that this information reaches as many dentists and as many physicians as we are in the lay public, okay, because all the groups need to know about it. The stuff we're talking about directly impacts the incidence of heart attacks in this country, which is still the #1 cause of death in this country. It's the number one reason why a 55-year-old man just gets taken away at his prime and leaves his wife and 2 kids high and dry after doing everything right, eating right, supplementing right, doing everything right, but he went to the wrong dentist at the wrong time, and now he's either going to have a fatal heart attack or a crippling heart attack. So this is serious business. It affects a large number of people, more than any other issue really that I know of. So people, dentists, physicians shouldn't get all up in a snort or up in a sniff because they don't know about this and just reject it out of hand, out of intellectual arrogance. They should open their minds and look at the science and realize, hey, there's a better way to do this, and then start educating themselves, because this isn't stuff I pulled out of thin air. It's all there, it's all real, and we need to come to grips with it as a society.
I want to sort of go back a bit in time, and then I want to come back up to the future, because your history with Dr. Huggins and your awareness of the pathologies that are created from well-intended dental interventions is now notorious. But I can harken back to the early 2000s. I don't even know if you know this. We had Dr. Huggins actually here in Pittsburgh with us, and he had the famous Huggins Clinic right out of my office. And what I learned was they came, and it was funny because they came from all over the world to have the great Hal Huggins work with them, because these people are so ill, they were so sick, and no doctors could tell them what was wrong with them. It was they themselves who, perusing the internet, came to the conclusion that it had to be their dental status, whether that be amalgams, cavitations, or root canals. And Dr. Huggins literally worked out of my office with a bunch of other dentists. And so I learned that vague, undiagnosed problems, and if you're listening to me right now, to my listeners of today, if you have a problem and you can't seem to get to the bottom of it, what do you think, Dr. Levy, your dental issues maybe have led to that undiagnosable problem? Could you take that for just a moment? Because I know you're so adept in that arena.
Nothing could be truer, Dennis. I mean, the vast majority, I'll repeat that, the vast majority of chronic degenerative disease, which means heart disease, which means cancer, which means every other disease, begins in the mouth, the vast majority. So it's kind of funny. Back in the movie Ben-Hur, when Charlton Heston won his Academy Awards, I don't know how many people remember this. There was a point in time where they were picking gladiators, and Charlton Heston was slogging in the straw mud pit making bricks, and they wanted to find healthy people to come be gladiators. And if you go back to that movie, what's the first thing the guy does? He pulls Charlton Heston's lip down to look at
his teeth. Exactly.
Okay? If you've got a healthy mouth, you've got an overwhelming likelihood of a healthy body. And if you've got an infected mouth, you don't have an ice cube's chance in hell of having a healthy body. That's how strong the correlation cause-effect is. Now, how things get affected? Well, different things come into play. When you have a lot of toxicity and infection in your body, hey, remember calcium? Your calcium-phosphorus ratio gets out of balance, and all of a sudden you start precipitating calcium in your tissues more than you start mobilizing it. And what do we say about calcium? Calcium is like the common link toward developing and exacerbating all these chronic degenerative diseases, because they all have excess amounts of calcium inside the cell. But it still ultimately begins with the chemistry derangement that chronic dental toxicity and infection causes.
Well, that's just a word of the wise to our listeners who are suffering for unknown reasons, and nobody seems to be able to get to the cause of why they are having that problem. Let's just say, boy, I'd sure love to see you here, and we'd get right to this issue of your dentistry. But then fast forwarding in your newest book, really isolating on the number one killer that we know out there, which is heart attack, you take it to a new level. This thing about if you've had a heart attack, it more than likely was due to a root canal to begin with. This is high, and then if you want to prevent that heart attack, you best take care of your dental status way before the fact. Wouldn't you say that is the take-home message here, Dr. Levy?
No question, no question. I would also quickly add, not because it doesn't deserve a lot more time, but because of the fact that it needs to be mentioned, is, and this is something I recently encountered. It's old information, but I recently encountered it, is the overwhelming importance of normal thyroid function throughout your body. Traditional thyroid tests are almost worthless. There's a very large percentage, in my humble opinion, probably well over 60, maybe 70% of people in this country, adults, are at least minimally hypothyroid chronically. But it's never going to show up on their blood tests. But it relates directly to their fatigue, to all their different problems, to their, well, you name it. I mean, thyroid is the metabolic regulator of the body. But what was determined back in the 70s by Dr. Broda Barnes is he treated 1,500 people with thyroid hormone in the form of desiccated thyroid, and over a 20-year period, four of them had heart attacks. If you looked at the Framingham study, the same age group over that period of time, there have been 75 heart attacks. So the point being is, getting normal thyroid function is one of your strongest preventive mechanisms toward the evolution of atherosclerosis, even when you have the presence of such horribly toxic and infected entities such as root canals. And we've also shown, and we're now seeing, that using such exotic things as looking at the T3, reverse T3 ratio, we can now get an idea as to whether or not somebody is hypothyroid inside their cells, intracellular hypothyroidism, rather than just looking what's circulating in the blood, because that's what's holding the real clue, I believe, to whether or not somebody is getting proper thyroid hormone regulation.
Now, you're hypothyroid, and then you go get a root canal besides? Whoa! Looks to me like the double whammy of a lifetime here.
Exactly. Yes, sir.
I want to ask you a question. I deal, and I'm sure you do, deal with the various up-and-coming organizations out there, and there is a movement in the dental community. And I go to these alternative meetings, and I'm meeting alternative dentists who believe that they can do a sterile root canal. And they take painstaking efforts to describe how it can be done, and through the use of ozone and other things which I guess are unique to their experience, they claim it can be done. I see in the same room one group of dentists say, I don't believe that can ever be done, while a new group is saying it can be done. I'd like to ask you, with how you look at the survey the entire terrain, what do you think? Any merit in that? Is that a possibility, or is that a bunch of bunk?
It's a bunch of bunk. It's interesting because it's like if you smear an infectious agent on your desk and then you just take something and wipe it off. Does that sterilize it? Of course not. What some of a well-done root canal can do, and I say well-done in terms of technical expertise, is it can debulk the infection. It can take out 70, 80, 90% of the physical presence of the infection. But I mean, a tooth is supposed to be sterile. Now, is there any way you're going to do something with a large mechanical tool that's going to pluck out every pathogen? Of course not. It actually, from a scientific mind point of view, borderlines on asinine to try to think otherwise. Now, ozone, these type of things are great. If, for the sake of argument, and I only say for the sake of argument, you could put ozone in and sterilize the tooth, guess what? You've still taken out the nerve in the blood supply, and it's still sitting inside the most pathogen-ridden part of your body, your mouth, and the natural fluid flow when you did the root canal treatment has now gone from inside out to outside in, so that these pathogens are continuing to come into the tooth. It'll be infected again in a few days. So even if, for the sake of argument, and I'm not saying you can, I'm just saying for the sake of argument, you could temporarily sterilize the tooth, it doesn't stay sterilized. And in fact, Dr. Weston Price looked at these teeth outside of the body, and he couldn't sterilize them outside of the body until he used very, very prolonged high-temperature autoclave treatments. So the pathogens get inside the microscopic dental tubules, and they sit there and they stay there.
Well, that's a definitive enough answer for me. I even see, within the dental community, there is a controversy going on. Those that say you can, those that say you can't. And I always felt that Huggins would have said bunk, baloney.
There's a difference between scientific thinking and wishful thinking. They want to believe it's true. But believe me, wanting to believe something true doesn't change the science.
Well, fair enough. Now, we're coming up to another break, and I'm hopefully going to ask you just to stay over a bit, so I want my listeners to feel comfortable with knowing the fact that we're going to bring you back. But as we approach the time for a break, how then does one who has that tooth so sore that is confronting doing the root canal, I mean, let's just have some gut-wrenching honesty here. What do you do? What do you do in that moment? You need to know this because your dentist is going to tell you you should have a root canal, and then you're going to be pretty vulnerable at that moment. So how do you advise our listener to comport themselves knowing that they're going to be in a situation like this? What do you do?
If the tooth is infected, by the tooth, I mean the pulp, not just outside on the gums, but if the tooth is infected, if you're interested in the long-term health of the body, and I don't say that sarcastically, the tooth has to be extracted. But even more importantly, it's got to be extracted properly. So if you already have a dentist who's pushing you for a root canal treated tooth, odds are he or she doesn't extract teeth properly anyway. You need to find a biological dentist who will not only listen to your wishes and work with you, but they'll take the tooth out and then clean out the socket thoroughly so that you don't have long-term problems resulting from an improper and incomplete extraction.
Yeah, I would say that, and I remember Dr. Huggins telling me the word cavitation was his invention, and it does not even appear in any dental books published in the United States at all. So to think that your dentist is going to be aware of how to prevent a cavitation when his literature doesn't even mention which one is, I think you know the answer to that one. Toxic tooth, how a root canal may be making me sick, and I think we've made the impression that your illnesses of the future might very well have something to do with it. We'll be back in a bit with good friend Dr. Levy. Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. We're here with Dr. Thomas Levy. We've been talking about root canals and how detrimental and devastating they can be to your health and may even lead to your demise. With that being said, we welcome our good friend Dr. Levy back. You out there, Dr. Levy?
Yes, sir, Dennis. Right here.
We're coming up in that final segment now, and I'm very much interested in where this earth-shattering information came from. And so you spoke about it quite tacitly whenever you first brought up these Finnish study that you're basing all these conclusions on. And as a scientific person, I'm trying to, and I know you're a scientific person, so tell me why you're so convinced. How large of a study was that? And I did get the idea about the labs and the fact that they were able to take the clots from, I mean, go over that again. That is the key, in my opinion, to the point that you and Dr. Kulatz are making in your new book.
All right. It was published in 2013 by Dr. Pessi, P-E-S-S-I, and a large cohort of co-investigators. It was entitled Bacterial Signatures in Thrombus Aspirates of Patients with Myocardial Infarction. And I'm looking at the article right now, and one thing I noticed that's almost ironic, it was published in Circulation, which is one of the most significant and well-read of journals by cardiologists.
Very prestigious journal.
Yet I still have not heard of any cardiologist talking about this. Anyway, that's just an aside. So they looked at 101 patients who were undergoing percutaneous coronary interventions with traditional ST segment elevation myocardial infarctions. 76% were male. The median age was 63 years. Okay, they looked at these aspirates and they checked for the DNA associated with different pathogens. And as it directly says here, bacterial DNA typical for endodontic infection, endodontic means root canal, mainly O. viridans streptococci was measured in 78.2% of thrombi, and periodontal pathogens were measured in 35%. So this is pretty big. And they also noted that the concentration was very high inside as well. Okay, that the concentration of these pathogens inside the blood clot itself was 16 times higher. Is it even possible to think that a sterile blood clot formed and all of a sudden, in seconds to minutes, you had this huge concentration of pathogens inside the blood clot? I think that defines logical thinking.
Yeah, it does.
So I mean, this is what I would call, and I can't think of anything more definitive to call it than the smoking gun evidence link between root canal treated teeth and the long-standing known association between periodontal infection as now being clear cause and effect for heart attack.
Yeah, there's that word smoking gun. I knew you had mentioned it earlier. It shot by me. I'm trying to remember the word. Smoking gun. That is the definitive way to make that cause and effect present. The fact that the concentration 16 times higher, you say?
16-fold higher than the surrounding blood. 16-fold. I mean, if people like percentages, that's 1,600% more.
So now that's one study, and haven't heard of some other research group in the country or in the world picking up on it. This is one study and one study only, but it's pretty. Any other studies that you know of, maybe in the near future, on the drawing board right now?
Think about the coordination that's needed for a study like this. You need research groups dealing with cardiologists at one huge institution, willing to send them specimens. Just getting the coordination for a study like this is mind-numbingly complex. I mean, I was blown away when I read the study, as much by that fact that such coordination was required as anything else. I mean, most studies are simple. They're just in the laboratory. They look at one thing. They measure something else. But this was a big-time coordination. And as I mentioned earlier, the same group found the same profile of pathogens inside ruptured cerebral aneurysms, and they found the same profile of pathogens inside the physiological amount of pericardial fluid in patients at autopsy that had coronary artery disease.
So you're saying the next logical conclusion is whatever ails you, more than likely you need to check the DNA of the exudates or whatever's found there. And you may very well make the correlation between that particular lesion, no matter where it is, and the root canals in that individual, just as the issue with the cardiology, the heart attacks has already. That's
good point, Dennis.
Yeah.
And, you know, I didn't actually coalesce that until you said that right then and there. But yes, if they did the same type of testing, let's say on joint fluid in rheumatoid arthritis patients, I bet you'd see the same thing.
That's powerful, very powerful, and so it makes me feel relatively good. You know, there isn't a case that goes by in my office where we don't get down and dirty with their dental status, talking about the big three, the amalgams and root canals, and of course the cavitations that I had mentioned earlier, all looking to see, you know, what their status is. Now, I've often said, and I'm going to ask you what you think about it. I've asked for thermographic evidence. In other words, I find that in order to prove to a patient that they have an anomaly, because they can't feel of their tooth a lot of times. Now, there are some people that say, I did that root canal. That thing has never been right since day one. I knew there was something wrong with it.
Never been right.
Never been right.
Never been right.
Never been right. Then I got others who claim they have no awareness of anything going on in their mouth. There's no pain and discomfort. There's no heat sensation. And so in those, I'd like to get some sort of confirmation for them. And I thought that what might be helpful is a thermogram. Help me. Do you feel that the thermographic pursuit is beneficial at all in this particular regard?
I think it would be. I think they need to refine it a little bit so they could be more focal, but I think you could be able to find stuff going on in the mouth and certainly see an asymmetry from one side to the other. I got to mention this, though. You said about the ones that say, well, this tooth feels perfectly fine. That should even give you more of a alarm signal. Dr. Weston Price found many years ago, think about this, the most toxic root canals were the ones that were completely asymptomatic. Basically, if you do have a little bit of pain, if you do have a little bit of discomfort, it's your immune system still fighting. When there's finally no pain, the immune system has sort of cashed its chips in on that particular tooth and is no longer mounting an immune response against it. But bottom line was, Price consistently found that the least symptomatic of the root canals in his testing were the most toxic.
Well, now there you go. That brings a new perspective in that I hadn't thought of. So, hey, if it could have amounted a response, you wouldn't be feeling so good upstairs. The fact that it's completely there's no symptoms, it's asymptomatic, is not necessarily a good thing at all.
That's correct. At least in the case of root canals, yeah.
Well, I'm going to keep on doing those thermographs. I'm glad that you feel that may be a good place to go, because literally I see these things light up like Christmas trees, and that heat signature accounts for something, especially when they're telling me this tooth feels completely normal, and I can see that it's not normal, and then it matches up.
Now, let me say this. I don't have a clinical practice now, but I would submit this to you, Dennis. You can buy a laser thermometer. You know, you just direct the laser light and you get an extremely accurate temperature. Start routinely looking at the gum line, well, just below the gum line of a tooth with a root canal and a tooth without, or in other teeth, collecting that evidence and seeing what sort of statistical variability you have amongst the different teeth. But if you have a hot area, it's going to show up with that little laser gun.
I will check that out. I really wasn't familiar with laser thermometers, but once again, you've been very illustrative to me, and I'll go find out more about it. And I think to have one in because I don't have a thermographic machine. I got to send people out.
They're $40 or $50. It's not a big investment, and it's amazing how well they work. I mean, of course, they use them in industry too to see whether a piece of equipment is overheating, and it's very, very, very accurate. It's very accurate at a distance too.
Well, now look, Dr. Levy, you're inbound once again, and it looks like you're set to cause more havoc this time than ever before. You're inbound to Pittsburgh again. You're going to be at the Freedom of Choice and Cancer Therapy Group. That's going to be coming up on the 20th. Am I right about this? The 29th of the month, correct?
29th.
29th.
Thursday, I believe.
So it's the last Thursday in the month of October. Folks, you don't want to miss them. If you've got issues and this conversation today has been bothersome for you, you want to catch the opportunity to meet Dr. Levy and listen to his presentation with all his slides. I'm sure you got some great slides to go along with this. I intend to be in the audience, by the way, that night also, so I'm looking forward to it. And I'm looking forward to see you again, good friend and colleague. I've appreciated you so much. You've been so helpful to me in clearing up some pretty difficult concepts. This one now, it's canned, it's locked, it's in the box. Thank you once again. Thank you once again, and I'll be looking forward to seeing you on the 29th. Until then, have a wonderful time, my good friend. I'll see you.
Okay. Thank you, Dennis. Take care.
Bye now. Hey, good morning and welcome back, folks, to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you in the second hour of our show. Interesting discussion, was it not, with our good friend, Dr. Thomas Levy. If that has opened up a can of worms, that doesn't make you feel too good. In a way, I'm glad I had the opportunity to bring you some very important medical information that may have just gone by you in the past. And now with this new book written by our good friend Dr. Thomas Levy, The Toxic Tooth, available on Amazon. We didn't get a chance to ask him where you could get it, folks. I can tell you for sure. It is found on Amazon. You can go and sign up and get a copy of it today. Of course, as I mentioned just prior to taking the break, Dr. Levy will be in town. I think it's a wonderful idea if the topic has caused you some consternation and concern and you'd like to know more about it. By the way, I'm sure he'll have books with him. He's going to be here on the 29th at the, and I said the Serbian. It is the Slovenian Center. Let me get this right. The Slovenian Center. It's going to be held at 7 o'clock at the Slovenian Center in Cheswick. Now, we've had to stay clear of Oakmont because of that bridge, the whole bridge. And so now we're holding these at the Slovenian Center. When you get off, the best way to tell you to get there is when you get off of the turnpike at Allegheny Valley Exchange, stay in the left lane as you come out of the turnstiles of the turnpike and go north on 28, Route 28 towards Cheswick. The very next light you come to is your checkpoint, and the very next road after that light, I want you to turn left. And when you go in 2 blocks, you'll be at the Slovenian Center. Hopefully you'll enjoy the evening. I do intend to be there to listen to my good friend, Dr. Thomas Levy, and you will have an opportunity to meet an unbelievably talented scientist that gave up clinical practice many years ago, really because of the influence of a wonderful man, Dr. Hal Huggins. It's Dr. Huggins' work that really all of this stuff spills off of. I guess the newest thing brought into the picture is, whereas it was vague before about toxic dental issues leading to all disease, the fact that there's a smoking gun to be able to conclusively show that a root canal absolutely positively leads to heart attacks, that's big news. So hopefully we'll see you there on the 29th, and I'll give that information as with each passing week. You may want to call up to meet us here at our office, because you might find that you want a little help in guiding you into getting the correct medical attention, and that also now means dental attention. So if you'd like to come in and talk to us so that we can talk about your medical issues, and then maybe not maybe, I can tell you for sure, we'll be delving into your dental issues almost without you having to have mentioned it to us. We would have already mentioned it to you, and we'll be talking about how we should proceed to determine what dental issues are going to be required to deal with your problem. Now, we'll let you come on in this morning if you got a mind to. You want to come in and ask any questions. I intend to take us up to the top of the hour and through the bottom of the half hour with some salient points that I think need to be discussed. But if you have an issue that you want to discuss, you want to ask a question, of course, the number to do that is dialing us up at 412-922-1320. That's 412-922-1320. I think the question really should be, what should you do about your dental status? And that calls into question what your dentist's role really needs to be in your overall health. And I think maybe that's a issue that you haven't really looked at it that way in the past. The way I actually feel about it is that your dental issues and the correction of your dental issues should be a collaborative effort between the medical doctor and the dentist. Certainly the technical issues of how you do what dentists do is not the domain of a medical doctor, but the health consequences to the decisions you're going to make and your dentist will make have an overbearing effect on your medical status. And with that being said, you really do need to have a medical doctor help direct you into what should be done in your behalf. Now, we got 3 things that dentists do, right? I mean, well, they actually do 4. but one of them, they don't do too much anymore. The first of the 4 things that dentists do that they probably don't do this one any longer is the cleaning of teeth. Because just about every dentist I know has their own dental hygienist. And the dental hygienist is cleaning the teeth and does a pretty doggone good job of it. You may still have a dentist that does his own dental hygiene work, and that's probably a unique oddity in this day and age. But be that as it may, it was a nice service that the dentist always provided. The next 3 tend to be potentially a problem. The second thing that dentists do is they locate dental decay, they remove that decay, and then they plug the hole that they just carved out in that tooth with a material in order to restore the tooth to full function and not allowing further decay to occur. Now, in many years past, the substance that was used to be able to plug that hole was dental amalgam. And it was used routinely for many, many years. If you are in your 50s and 60s, you may very much still have the remnants of that dental amalgam. If you're looking into your mouth and you see anything in the mouth that's either silver or at this point black, because the oxidation of mercury amalgam over years doesn't leave it to remain so much silvery looking anymore, then you've got mercury amalgams, and you do have a problem, because the amalgams, by definition, have to be at least 51% mercury. And mercury is deadly, and mercury leaks from dental amalgam from the very first moment they're ever placed in the mouth, and they continue to leach that mercury for the remainder of their existence, no matter how many years that is. This has terrible health consequences, and it's nice to see that at least at this point in our evolution of understanding the role that amalgams can play, there are very few dentists that actually use mercury amalgam fillings anymore. I will say that you have to be certain that you ask your dentist, that's the first question you want to ask, do you use amalgams or composite materials? And we hope that your dentist says that he uses composite materials to fill the holes that the so-called fillings using a mercury amalgam of days past would have been routinely used. Hopefully not any longer. And if you are a parent, you want to insist that no mercury amalgam be used in your children's behalf, no matter if the dentist says, oh, this is just a small filling, this is a baby tooth. I mean, filling the baby teeth may be a problem from the get-go anyway. Why should we use any composite material? This tooth will probably be ejected from the body in the next couple of years. Anyway, all that doesn't matter. You want composite materials to be used. I should say something about those composite materials, because there are literally, and I was amazed to hear in discussing this with dentists, there are literally thousands of different compounds available to a dentist in order to be able to select one to use on your behalf. What normally happens is that a dentist gets comfortable with a couple of them, 2 or 3 of them. He keeps those 2 or 3 in stock, and then he does all of the work that he's going to do with the 2 or 3 composite compounds that he has selected. This turns out to not necessarily be the correct way to do it, because even though any one of the composite materials is not by its very nature toxic, it can be reactive in any given individual because their immune system recognizes it as harmful or toxic. And for that very reason, especially I would say if you consider yourself to be quite sensitive to chemicals, are quite sensitive to infections, or if the word sensitive has been used to describe you or for you to describe yourself, it is you in particular that needs to request compatibility testing before you allow any of these materials to be used. what compatibility testing does, and there are a couple of labs, the Clifford lab in Colorado Springs. Colorado is probably the most well-known of the labs, but a blood sample is sent to Clifford labs, and then your blood is exposed to all 1,000 or whatever number there is, and I'm sure going to be off, but your blood is exposed to every single one of the composite materials, and we can read the reactivity of your blood with those substances to determine which ones are highly reactive and, of course, which ones are not reactive at all. And then you would be sent a list, a pretty lengthy list of what to avoid and what to use in your own behalf. So the issue of fillings should no longer have anything to do with amalgam ever again. And due to your sensitivity, if you do have the ability to show immunological reactions as a routine in your own physical makeup and constitution, you more than likely should consider compatibility testing. Be difficult to have that discussion with your own dentist. You more than likely are going to have it with us, and you'll need to set up an appointment so we can arrange for it. The second thing that dentists do is root canals. Now, I know there's a whole field of dentistry called endodontics, and these are the experts of how to do root canals, but it's certainly within the realm of the doable for your dentist to take a track at it. I think we don't even have to have a major league discussion anymore today after all the chit-chat.
1 minute, doctor.
Okay, after all the chit-chat that we've had with respect to root canals this morning, you can't have a root canal. You must, unfortunately, request that it be extracted. Which leads to the third thing that dentists do, and those are the extractions. So what I'm going to do is I'm going to hold off talking about those extractions for a moment. We're going to take a short break for news. Come back. We still open it up to you today if you got a mind to, 412-922-1320. We'll be right back in just a moment. Good morning, everybody. Welcome back to the Weekend Wellness Workshop. We're here each and every Saturday and Sunday from 10 to noon, bringing you information and medical discussion that, bar none, is some of the finest you'll ever could be able to come across. We've been doing this for about 20 years now in terms of offering alternative approaches to treating your medical issues, and I am an alternative practitioner for those 20 years, and hopefully have the opportunity to help you in the near future with your medical issues. But the topic today has been centered around a book written by our good friend Thomas Levy, a board-certified cardiologist and attorney, called The Toxic Tooth. And we've been learning a lot about root canal teeth, and I'm opening it up to allow you to come on in if you want to ask some questions about this. The number to do that is 412-922-1320. We do have a caller. Why don't you come on the store? Hello, welcome aboard. What's on your mind?
Yes, Dr. Courtney. Do you know of any dentists like you're talking about out in Murraysville or Monroeville area?
There actually are, and that was going to be one of the very issues that I was going to discuss next. You've got to be able to identify a biological dentist that is Huggins trained. So there are very few, and I mean very few, of such dentists in Western Pennsylvania. There are a few located in the east and some in the central part of PA. I have one or two in the South Hills area. I'd really prefer that you contact me so that I can deal with you directly to tell you which dentist or dentist may be in your backyard, because I want to talk to that dentist first, okay? But there are a few.
Call your office then.
Yeah, call the office.
Call the office.
Yeah, call the office. My number here is 724-942-3002 to find out what dentist has the training to do this right. In fact, I'll be talking about that very selection process in here in just a moment. Great question.
Okay.
Okay?
Thank you.
Absolutely. Yep. Yeah, folks, finding a biological dentist takes more than just the, I guess would be the declaration on the part of a dentist that he feels as though he's a biological dentist. Because in my past, I've found that those that claim to be able to do that kind of work never had the training to do so. And I often find, too, that cinch amalgams have been pretty much thrown out of the dental office as even a tool to be used now. That's a good thing. Believe you me, I'm absolutely in favor of it. It's easy to find dentists that claim, oh, I can take those amalgams out for you and replace it with a healthy material, almost giving you the impression that they are a special kind of dentist, that in fact they themselves don't use and would never use mercury amalgam fillings again, and they would be more than happy to remove your amalgams to replace them with a composite material. That alone will be tantamount to causing or potentially putting you in serious medical harm, and here's why. The Huggins-trained dentist has a certain procedure that must be followed in removing dental amalgams. The equipment that the Huggins dentist has to have is different than the equipment used by a general dentist, and so even though the dentist may claim to be able to remove them, and he certainly will remove them, your exposure to mercury toxicity will be no higher on that day than any other time in your life if you allow that dentist to remove that amalgam. Because as the drill bit is starting to chip away at the amalgam, literally the mercury becomes vaporized and highly toxic at the time of the extraction of the dental material. And as such, you need to be protected against this very large exposure that no matter what dentist is going to be working on you, the exposure is there. There just better be the right equipment to quickly off-draw the gases coming off of that drill bit so as to not, or at least I think better said, to minimally affect you. So just to find a dentist that claims that their biological isn't good enough, you must ask some additional questions. These questions are you Huggins trained? Are you Huggins certified? This great Hal Huggins determined way back in the 1970 era that there were serious problems with dentistry. He's the one that made the connection between mercury amalgam and disease. He's the one that determined that root canals were certainly injurious and maybe even deadly. And he's certainly the one that determined that cavitations, which we're going to talk about in a second, which are caused by a way a tooth is extracted, also leads to serious health consequences. He was rewarded for his discoveries, as one, I guess, isn't going to be surprised to hear. He was rewarded by having his dental license removed from him, never to be able to practice dentistry again. Goes to show that no good deed goes unnoticed. Hal Huggins scared the pants off of the dental community back in the 1970s, and they haunted that man through his entire life. He worked through other dentists that he then trained, and he was able to do his good work up until the time of his untimely death back in November, a year ago this month. We lost Hal. Anyway, he trained a lot of dentists. He specifically trained dentists in Western Pennsylvania, and you need to know who they are specifically by name. And as I've already mentioned, you'll want to call the office to get the names of the individuals in your area that qualify because they are Huggins trained. And that number, once again, at our office is 724-942-3002. Now, I wanted to just spend a little moment on this extraction issue because, as Dr. Levy pointed out, the root canal is the absolute worst in terms of being able to cause infectious material to spread throughout the body. But the cavitation can be a close second behind it. So the word cavitation, I've already mentioned once, does not appear in any dental books found in the United States at all whatsoever. So if you happen to be using the word cavitation around your dentist, I can tell you, you'll be talking in another language. He will not know what the heck you're talking about. And so that should be the first clue that you may want to change dentist. The second thing to say is, when a tooth is extracted, which is the third thing that, well, the fourth thing that dentists do. They clean teeth, they fill teeth, they root canal teeth, and they extract teeth. When a dentist extracts a tooth, he removes the tooth, and the very next thing routinely that is done by the dentist is that he rolls up a wad of gauze and tells you to bite down. Now, the intention for why he's doing that is a good one. He's trying to get blood to clot. However, what he never does, and I mean never does, is he never removes the periodontal ligament. This piece of tissue is a soft tissue that connects each tooth to the bone that the tooth resides in. And when a tooth is extracted, it's more or less like a roll of the dice. About half of the time, the ligament stays adhered to the tooth and comes out of the socket, out of the hole there. And another half of the time, it stays adhered to the bone and remains in the hole. Now, this gum gingival tissue closes over top of that soft tissue, which is now dead, and will begin putrefying. I guess that's a fancy word for rotting or decaying, starting the very next day. It'll be bacteria that do that rotting, and in particular a group of bacteria known as anaerobes, and the anaerobes are very well known to produce almost the deadliest neurotoxin known to man. That's bad enough, but starts an infectious process that just continues to move from consuming the soft tissue right on into the bone in that socket, that hole, forming this thing called a cavitation that Dr. Levy was talking about. He's right. So many times these are very small, but many times these are large, and they can be detected and can be repaired, but oddly enough, because the word cavitation doesn't appear in any dental books in any dental school in the United States, a discussion of how to repair them cannot be had with your dentist unless he happens to be one of the Huggins trained. Because when a Huggins trained dentist extracts a tooth, he removes the periodontal ligament. That's a must. Interesting story. About a year ago, I had a teeth that required to be extracted, and I went to my biological dentist, and on the particular day of the extraction, he wasn't available, and so another dentist that works with him was going to do the extraction. And so as she was preparing to glove up to do that extraction, she asked me if I had any questions, and I said, well, of course, you are going to be able to remove the periodontal ligament just like the other dentist would have done. And she looked at me very perplexed, because remember now, if you don't know what a cavitation is, and you don't know about the periodontal ligament being a big deal, this is catching her very much by surprise. It caught her so off guard that she just stopped, and we had a face-to-face confrontation about how she would determine how it would be that extraction would occur. As a dentist, it was her God-given right to do that doggone extraction in the way she felt it was needed to be done. And it became obvious to me, without the need for additional confrontation, that I needed to get up out of that chair and get the heck out of that building, which I absolutely did. And ultimately, the tooth was extracted in the correct way, where the ligament was removed about a week later. This is my point. You need to have that discussion with even the removal of an extraction, because that periodontal ligament can lead to very similar consequences as the root canal tooth absolutely leads to in 100% of the cases. And that's 100% of the time, whereas the extraction is a 50-50 proposition. So, of the 4 things a dentist can do, 3 of them could be deadly. And the amalgam probably isn't even on the list anymore, but root canals and extractions really need to have a special touch. And we thank Dr. Hal Huggins for having provided us with such an ability to understand and appreciate that. Now, we're going to come back, take a short break. I'm going to talk about how it is that we identify these teeth in my own practice, and maybe giving you a shove off of the pier to take this on your own to sort of figure out what your own status is. So let's take a short break, and we'll be back in a moment to continue more about the toxic tooth, toxic teeth, and how to avoid the medical problems that can result from them. Be right back. Good morning and welcome back, ladies and gentlemen, to the Weekend Wellness Workshop. TW3, we call it, and we're here at the Talk Radio 1320 WJAS. Enjoyed the discussion today on the issue of dentistry and how dental interventions can lead to some pretty serious medical consequences. And I mentioned with my discussion with the great Dr. Thomas Levy about the use of thermography. I find that that it's very helpful when having a discussion with a patient to ask to have them get a thermogram. Of course, a thermogram is nothing more than a picture of you taken by a very sensitive infrared camera, able to detect changes in the surface of the skin of the body, and there are wide variations in temperature when you look at the body in that way. A very colorful picture is taken. Various colors on that picture correspond to changes in heat, and I think 1 degree of temperature change is represented by thousands upon thousands of colors. So what I can tell you is that when there is a dental lesion, and the amalgam will not be able to be detected as a problem through thermography, but what will be able to be detected, and pretty much with clarity, is whether or not you have a root canal that is currently causing you a medical problem, or whether or not you have a cavitation that's doing the same. And so by taking a head shot, and when I have my ladies and gentlemen get their first thermogram, I tell them to get a full body thermogram. First thing, make sure the head is included, because I want to see what your dental status is. And then usually the telltale heat signature is there, because with a subclinical infection, which is what Dr. Levy was talking about this morning, where you can't really perceive it, and which, by the way, he shed a new light on, saying that if you actually had an earlier problem where you could perceive something wrong, that more than likely was a good thing. But if you have such an advanced situation in your mouth that you have no awareness of anything going on with that tooth, that more than likely says this has progressed way far down the road, and that's a bad thing. So here you are with no oral sensations to tip you off that something's going on. You need some cue of the fact that the dental issue may be operational in you, and those heat signatures, as I say, cause blotches of heat to light your mouth up like a Christmas tree. And when we can compare the tooth numbers to the teeth that you've had root canaled and extracted to the heat signatures that we find on a thermogram, then that connection means that you get sent off to the biological dentist, and a prescription is in your hand from me, which directs that biological dentist to do A, extract the tooth that I numbered, or B, repair the cavitation that I numbered. And so this is the medical legal coverage that the dentist requires, because if a medical doctor is requesting that these two things get done, his dental board won't be able to rough him up like they would do if he just did that a cappella on his own or on her own. So we work in collaboration. That's what I was telling you. There needs to be a relationship between the dentist and the doctor, and the dentist would really appreciate that relationship, because it will help in covering him politically and dental board wise to do cavitation repairs where there's no such known procedure in dentistry. That's one thing. And of course, removing a root canal that by all dental standards would be said to be a completely, what are you taking that tooth out for? So says the dental board. That's a completely healthy tooth. And when in fact, that's a root canal tooth. And if there's anything that's a toxic waste dump, it's certainly that tooth. And under the direction of a medical doctor to remove it, that dentist has coverage. That's how we work it, folks. And that's why you need to have your dentist working with your doctor in combination with one another to get these items cleared up, so as to remove the predilection and predisposition you have to developing the diseases of your future. And if he now has proven with the smoking gun that beyond a doubt, about 100% of all heart attacks are related to a root canal, well, I guess maybe he said it, if you've had a heart attack, you have had a root canal, and vice versa. Anyway, that's my recommendation. Get a thermogram done. We have thermography being done in our office here once a month. There's a group called Three Rivers Thermography. They're located on Babcock Boulevard. You can easily find out if A, they're in your geographical area. Just go to them there. You don't need a prescription to have it done. They may be at a doctor's office nearer to you than mine, or C, come to my office after you call up to find out what day of the month they'll be here, and get the thermograms that you'll be getting, and include the head. The number here at the office, 724-942-3002. Now, I'm going to leave you with a story that I just, every time I think of this, I'm just bewildered and in wonderment on how this particular medical problem was solved. But it goes to show how intricate the root canal can provoke a medical debacle of huge proportions simply because of that root canal was present. Now I'm going to be talking about a doctor, a brilliant doctor. His name is Dr. Jerry Tennant. You don't know Dr. Tennant yet, but he will be coming as one of my guests in the up-and-coming shows. And I'll let him retell the story, but today is a very appropriate place to have his case put up for your perusal. Dr. Tennant is a ophthalmological surgeon, and he did the initial research on LASIK therapy in the early 1990s. What he found out was that when he was doing LASIK surgery, eye tissue was vaporized by the laser, but viruses were not. And what happened is in a particular patient that he did LASIK surgery on, who had a viral infection, the organisms that were released by the vaporization of the tissue came up underneath his mask, into his nose, and directly into his brain. And Dr. Tennant was diagnosed with encephalitis as a result of it. He was bedridden 16 hours a day for over 7 years. Let me repeat that. In bed, 16 hours a day for 7 years. He saw all the greatest medical minds of his arena and scope because he was an illustrious doctor himself, and all the great medical minds said not a thing can be done. By the way, that's always a tip-off that there's something that can be done when the conventional community says that nothing can be done. Anyway, there he was, saying that he had 2 to 3 hours of lucidity every day where he could read a newspaper. Then all of a sudden, he lost the ability to understand what he was reading and had to go back to bed. This went on and on and on and on. And Dr. Tennant, as brilliant as he is, finally made a decision, which was that he better figure out what was wrong with him and how to fix it, because it was quite obvious that nobody else was going to do it. Well, I'm not going to try to describe for you what I'm going to ask Dr. Tennant to do, how he figured out the schematic to correct his problem. But let's just say he was able to determine that the human body was like a portable electronic device, and that voltage put into the system could be the healing process. And for now, we're going to let it go at that. But let me tell you about a set of symptoms that Dr. Tennant had. Number one, he had a very sore big toe. Number two, terrible stomach pains. Number three, a spleen that was enlarged and led to a coagulopathy. 4, he had a scar in his left macula. And 5, he had encephalitis. Now, could you imagine any medical doctor putting all of those together and coming up with an answer to and a solution to how it could be that he was so afflicted? Well, as it turns out, he made a final conclusion, and that was that when a root canal was in place, it led to a shorting out of circuitry in the body. And you see there's actually a circuit in the body akin to the oriental meridians called the stomach and spleen circuitry. And it was the day that he decided and determined that that circuit passed through tooth number 14 on the left side of his mouth, which was a root canal tooth that was previously accomplished. And the fact that it was now shorted out led him to the conclusion that it better be extracted. I'll let him tell the story, but here's the punchline, folks. He went and got that tooth extracted. And within 72 hours of having the tooth extracted, that root canal tooth, all, and I mean all, of his symptoms went away. Jerry Tennant, that's his story. I'll have him tell the story when I bring him on the phone or on the show, but it was an appropriate time today to tell you about it. I look forward to seeing you next week with Dr. Ty Vincent. Until then, this is Dr. Dennis Courtney saying so long for the Weekend Wellness Workshop. Have a great weekend. Bye now.